Hospitals are under siege.
All the patients in this room, all the feet that you see, they all have COVID.
The video was shot by this emergency room doctor and sent to the New York Times to show the world what it's really like on the front lines of the crisis.
People need to know what is happening here. I applaud her bravery for really taking us behind the scenes.
The video was taken inside hard-hit Elmhurst Hospital in Queens, New York, where 13 people died in just one 24-hour period. You can see a long line of people, everyone wearing masks, waiting to be tested for COVID-19.
We need as much resources, as much staff as possible. We need all the help we can get.
At another New York hospital, 3 nurses were photographed wearing garbage bags over their scrubs for protection. The photo is shocking America. Look, one is even seen holding a box of hefty bags. That photo was taken here at Mount Sinai West Hospital on the west side of Manhattan. The nurse who posted it to Facebook writes, quote, "No more gowns in the whole hospital, no more masks," unquote. She said they had no choice but to reuse the masks.
It gives you a sinking feeling when you watch nurses risking everything to help others and they're wearing garbage bags. I mean, that's not America. We should be able to provide people in the front lines with the best equipment possible. We wouldn't send our soldiers in the battle with garbage bags.
In a statement to Inside Edition, Mount Sinai says, "We always provide all our staff with the critically important personal protective equipment they need to safely do their job." In fact, the troubling photo circulating in the media specifically shows the nurses in proper PPE underneath garbage bags. With medical personnel becoming the new heroes of these troubling days, a grateful husband pays tribute to those who are risking their lives to save others. "Thank you all in emergency for saving my wife's life. I love you all," his sign says. His hand is on his heart. The nurse from a hospital in New Jersey who took the photo writes, "He had tears pouring down his face. I asked him how his wife was. He said..."
What has it been like? Well, with me, it was a terrible time because of my breathing. Symptoms started with the temperature, shortness of breath, and tiredness.
Healthcare systems everywhere have been overwhelmed with coronavirus patients. Here's how hospitals around the world are dealing with mounting challenges.
We can't cope with a big spike. We just can't. We're planning for many more patients, so all our theatres to be full of COVID patients and possibly beyond. It is, none of us have ever seen anything like this.
We have a full ICU. We have every patient in here on a ventilator. Everybody has coronavirus, but some people also have heart attacks at the same time. This happens, and it makes things even harder.
Medical professionals are still scrambling for supplies in Italy, even as the number of new cases begins to level out. The country still has one of the largest and most deadly coronavirus outbreaks.
Tutti gli operatori sanitari della Lombardia, dell'Italia, tutto, sono stati praticamente lasciati a loro stessi con le misure, con le mascherine.
Without protection, doctors are scared.
Quindi non siamo eroi e abbiamo paura anche noi.
In Peru, hospitals are also experiencing a lack of equipment. The country has almost 10,000 cases as of April 14th.
Todos los pacientes, sean o no sean COVID positivos, están paseándose por el hospital sin tener siquiera una atención, porque ningún médico quiere atenderlos por no tener, lamentablemente, un equipo de protección personal, por el miedo a contagiarnos, por el miedo a contagiar a nuestras familias, a nuestros hijos.
As of April 14th, Spain has the second highest number of cases. The country is right behind the US at over 170,000. More than 15% of healthcare workers in Spain have been infected by the coronavirus. Over 4,000 miles away in India, train carriages are being transformed into isolation wards.
We have removed the middle berths and the one laboratory of Indian style, which is blocked and converted to the shower room, where the bathing facility to be done for doctors, nurses, and also for patients.
Sanitizing tunnels are also popping up at local hospitals to spray disinfectants as people pass through them. The country, with its high population of 1.3 billion, has about one public hospital bed per patient. Mildly symptomatic patients in Tokyo are being moved from healthcare systems to hotels. The dense city has been scrambling to find more hospital beds. An international fair area in northern Iraq has been converted into a 250-bed hospital. While hospitals provide a space to battle the coronavirus, it's the medical professionals who are on the front lines. And some are trying to remain positive.
On one hand, I left my kids at home so that I could go and fight this war along with my colleagues. But on the other hand, I feel optimistic. I feel hopeful because as a critical care physician, this is what we've trained for. We know that this is what we have to do, and we know that we're well equipped to do it.
Di sicuro non sono né i soldi né l'obbligo. Ecco, sono i pazienti, perché loro non hanno scelta. Quindi lo faccio soltanto per loro, e penso che anche per tutti gli altri miei colleghi, per tutti gli altri infermieri, penso che per tutti valga lo stesso. Ecco, sappiate che è una scelta dura tutte le volte che entriamo, però la facciamo tutti i giorni.